So once more, very good afternoon to you all. I welcome you all into the industrial pharmacy first. Dear student, we had already started the packaging materials. And in our previous class, in our previous lecture, we had gone through the what the packaging materials are, what are their properties, what is their ideal requirement, what are the different containers, and the different types of containers. All these things we had already studied in our previous lecture. We had also gone through the role, importance, requirement of the pharmaceutical packaging, and some of the basic properties of the packaging materials. Dear student, if you see the pharmaceutical packaging, that is something different from that of the rest of the general packaging, because the pharmaceutical product, pharmaceutical dosage form, these are going to be packed into a container, into a product. And in case of pharmaceutical industry, if you will see, there is a separate department which will work onto the packaging aspects of the dosage forms. So as such, if you see, it is an integrated part of any kind of pharmaceutical product. But actually, if you see the pharmaceutical packaging, it is not the integrated one, but it is the separate one. There is a separate department, there is a separate staff, there is a separate personnels, there is a separate quality assurance which will look after, which will work onto the packaging aspects of the pharmaceutical products. So that is what is the significance, that is what is the uniqueness of the pharmaceutical packaging compared to that of the other kinds of the packaging of the products. So today, basically, we have to see some of the legal and the official aspects of the pharmaceutical packaging, and we will see the stability aspects of the pharmaceutical packaging. Now, in order to understand these, we have to move, like say, the legal requirement of the pharmaceutical packaging, some of the official guidelines that has been prescribed, that has been given, that are uniform in accordance with that of the ICH for the pharmaceutical packaging, and some of the stability aspects. So basically, starting with the legal requirement, in case of the pharmaceutical packaging, the regulators, they will seize the pack as having the different characteristics. Now, what are the regulators? Regulators, these are nothing but the regulatory bodies, like say the FDAs, or say the CDSCOs, or say the state licensing agencies, right? So these are said to be the regulatory bodies. So they require, or they will seize the pack, they will want the pack in terms of the different aspects. They want the pack in terms of containing the product. Packaging, it is the device which will contain the product. So after containing the product, what that packing material will offer, it will offer the protection. To which it will offer the protection, it will offer protection to that of the product. The product should not get spilled, the product should not get wasted, the product should maintain its integrity, its properties, its identity, its stabilities, labelings, all these things. So these are the aspects associated with that of the product. Then the packaging that will offer protection to that of the consumer, right? Because there is a color, there is a liquid product, and if these are going to be properly packed, that will offer protection to that of the consumers. It will not get spilled off, or it will not come out of the packaging. Then the dosage control, right? Let's say in case of the tablets, in case of the capsules, These are going to be packed as a unit dose packaging, so which will offers convenience to the patients as far as the dosage control is concerned. Like say when we have to take one tablet, when we have to take two tablet, very easily we can go for calculating the particular dose. So it will also offer the carrying the labeling instructions, various information. Already we had discussed in our previous class. It will offer warning, it will offer direction for use, it will offer indications, it will offer the storage instructions. All these information that will be provided through the labelings. So the legal control of the product, like say the different legal requirement. Let's say for example, date of manufacturing, date of expiry, the manufacturing license number, the manufacturing batch, the price of the product, isn't it? So all these information that is provided in the form of the labelings. Then informing the recipient, like say the patients, how to store, keep away from that of the children, or shake well before use, right? Or to be reconstituted before use. So all such informations that are to be carried by the labelings. Then some of the aspects, like say the contaminating the environment, the packaging waste, ozone depletion that is more common in case of the aerosol preparations, like say the use of the CFC, compressed gases. So these are responsible for the ozone depletion. So all these are the aspects, all these are the legal requirements that are associated whenever we are going for choosing, whenever we are going for packaging of any kind of the pharmaceutical dosage forms. And all these should be fulfilled by that of the selected packaging material and the pack. The protecting consumer, like say the child resistant closures and the tamper evidence. The closure should be such that the children's they should not able to open it easily, because if they are in a position to open it, they can easily consume it, and that may lead to that of the intoxication, adverse reactions. There should be a tamper evidence. The labeling or the packagings that should be such that that should be tamper proof, so that once it is going to be opened, the consumer or the patient should come to know that it is opened one, it is tampered one. So such products or the such packaged materials should not be chosen or should not be consumed. Then, if you see, as I said, that the pharmaceutical packaging and the pharmaceutical product development, although we are considering these both as the integrated one, but these are not integrated, and these are the separate one, because there is a separate department which will work onto the packaging aspects of the pharmaceutical product. There is a pack, there is a product. And why then has the attitude of industry and the regulators that is going to be changed? There are different requirements, there are different pharmaceutical packaging aspects, and these are the several factors that why particularly the requirement or the attitude of the industries and the regulators that has been changed to that of the pharmaceutical packaging. In that, the very first one, that is the increasing sophistication of the pack. Second, that is increasing sophistication of the product. Third, that is incorporating a device into a pack. And fourth, that is the cost of development. So all these are the different factors which are concerned as far as the industries are concerned in case of the pharmaceutical packaging. Now, increasing sophistication of the pack that will include, let's say, for example, if we are using the glass material or to that of the plastic packaging, we know that plastic that is not transparent one, but compared to that plastic, the glass material that is highly transparent one. So that will improve the elegance, that will improve the look, that will improve the aesthetic appearance of the product. Then the glass is preferred because of its inert nature. Glass that will not show its own pharmacological action, or it will not interact with that of the product. Next, the plastic they will tend to interact with that of the product, and they will destabilizes the formulation, like say leaking, or say like say the passage of an gases or the passage of the air from that of the plastic material, and that will reach into that of the product. So because of this, the selection of the right packaging material that will becomes essential from the regulator point of view if we see. So there are n number of the glass material like say amber colored glass, flint glass, packaged transparent glass, there is a general purpose glass, there is a soda lime glass, there is a borosilicate glass, right? So based on the type of dosage form, based on the requirement, one can go for selection in order to fulfill all the legal requirement and the aspect. The second factor, that is the increasing sophistication of the product. This means that, let's say for example, if we want to go for developing a new drug, the development of a new drug that will require lots of money input. It is the lengthy process, it is the time consuming process, it is the labor intensive process. But compared to that, if we go for just modifying some kind of packaging of the product or improving the existing formulation in terms of its packaging is concerned, so that will gives rise to that of the new line of product. So compared to that of the developing a new product or discovering a new drug molecule, so the changing the packaging or going for improving or to have some kind of innovative packaging, that is the most reliable method in order to improve the stability of the product compared to that of the development of the new drug. The third factor, that is the incorporating a device into a pack. As we see in case of the aerosols, there are the meter dose aerosols using the advanced containers like say the nebulizers or the insulin syringes. Right. So insulin syringes, these are the pre-filled one. These are the doses that is already fixed. Just we need to prick the skin and we have to inject the content. We have to inject the insulin. That's it. Then we have to throw out that particular needle. Same as the case associated in case of the meter dose. The meter dose inhalers or the meter dose aerosol systems in a particular actuator, in a particular spray, in a particular use, that will deliver, that will expel only the metered amount of dose. So that is the incorporating a device into the product. So as I said that there is a insulin syringes, so which will gives the only required amount. Then, because of this improved packaging, there are some of the penless needles and dry vaccine delivery that is under development. Because the traditional method of puncturing the skin, that is painful, but to use the very small needles like say the insulin syringe needles, that is very very painless. Then the cost of development. Already I told you that in case of drug discovery, the process that is lengthier one, like say it may take around some 12 to 15 years in order to design, in order to develop a new drug, new product. Also, the cost which is going to be included, incorporated, that is too much high. And there are, we have to start, or the chances of success are very, very few. Let's say, for example, in case of cost of development, if we say there are different stages, like say stage one that is associated with the drug discovery, stage two that is associated with the preclinical study, stage three that is associated with the clinical trial, and the stage four that is the regulatory approval to that of the FDA reviews. So if we start with the drug discovery, that will consist of say around 10,000 to lakhs of compounds we need to screen, we need to study. And out of these, only few number of compound that will reach us to that of the preclinical trials. That is the study that is to be performed onto the non-humans, or it is the animal studies. Say out of thousands or lakhs of compound, only say few hundred, like say 250 to 300 compound that will reach us to that of the preclinical trial. And the whole that may take around 6 to 7 years, right? Then the and the IND approval, that the IND process that will be started. That is the investigational new drug, and the approval is going to be seek once the promising results that are going to be obtained onto that of the animals. Then, after getting the IND approval, one can go for the clinical trial. So, where the study that need to be performed under the phase one, phase two, phase three. So, in case of phase one, if we see, there are some hundreds number of volunteers that are going to be selected. In case of phase 2, the quantity that is going to be increased from 100 to 500, and in case of phase 3, say some 1000 to 5000 number of volunteers or the subjects that are going to be selected onto which the study that need to be performed. Again, the whole process that will take around several years, say around 5 to 7 years are required in order to prove the efficacy, safety, and stability of the product. Once the promising results has been obtained through the clinical trials, the application that is submitted to the regulatory body for the NDA, that is the new drug approval. So, as we got the promising results in case of the clinical trial, that the drug that can be used onto a larger number of population, and then again the post marketing study that is to be continued in case of the stage 4, so which will take again around 1 to 2.5 years. So the whole process, if you see, that is around say 10 to 13 years, and throughout all these we will be getting sometime a single product or a single molecule, a single new drug, a single discovered drug, or sometime even that may not be obtained. So the whole input, that is the time, money, everything, efforts, that will everything that will goes into waste. So compared to this, the working onto the packaging, working onto the innovative packaging, that is the most ideal one, and that is the most suitable one, and that is the most significant process in order to give rise to that of the new line of the product. There are some special types of closures, like say the tamper evident closures. So these tamper evident closures, these are for to prevent the tragic accidents and especially malicious tampering. Sometimes what will happen during the shipment, the product may get removed, or it may get adulterated, or it may get added, or it may get replaced by that of the substandard product. So that can be prevented with the help of use of the tamper evident closure system. Then manufacturers, they will try to create the safe packaging. The government, they will continues to update the regulations in the sense that the closures that must be sealed in such a manner that the content that cannot be used without destroying the seal. So that is the tamper evident. Once it is opened, that means it cannot be resealed, and the consumer or the patient or the purchaser, they will going to easily come to know that the product has been already opened one. If you see the definition of the tamper evident closure, the definition that is given by the US FDA, what does it indicate, or how that can be defined? It could be defined in in such a way that the tamper evident closure, these are such a type of closure system that will be having an indicator or barrier, right? It is the indicator or barrier. Indicator is what it is, some kind of strip, right? That means once it is going to be open, that will give, that will be teared off, or a barrier system, barrier in order to open, like say in case of most of the aluminum packaging, in case of the bottles, glass bottles, if we just go for opening the container, the lower rim that is in association with that of the upper cap, so if we are going on opening it, it will get completely separated one. So that is the barrier system. So it is, or the temper evident closure, these are having an indicator or barrier to entry, which if breached or missing, can reasonably be expected to provide visible evidence to the consumers that tampering has been occurred. So such a kind of packaging, it will act as a evidence that someone had already opened it. So this is the definition which is given by the US FDA. Now, in order to have this tamper evident closure system, there are different technologies which has been designed, which has been developed. So there are 11 technologies which are capable of satisfying the definition of the tamper evident packaging. And all these are, like say, the film wrappers, blister packs, bubble packs, heat shrunk bands or heat shrunk wrappers, paper foil or plastic pack, or the bottle with the inner mouth seal, tape seals, breakable cap ring system, sealed tubes or plastic blind end, heat sealed tubes, sealed cartons, aerosol containers, and all metal and the composite cans. So all these are the special types of the tamper evident closure system. So here you can see there are the picturized representation has been given. This is the heat shrink band. You can see it is going to be completely wrap over onto that of the cap. Then there are the temper evident closures. There is a cap and there is a lower rim which remain in association with this. And once it is going to be opened or once it is going to be rotated, it will get completely separated from its attachment. Then there is a temper evident labels. The labels or the stickers or the strips are attached over onto that of the cap and the bottle. So once the cap is going to be rotated or the cap is going to be removed, the band or that particular paper strip will get teared off or it will get break. Once it will, then there is, this is the clearly indicating that this is the clear cut evidence which will indicate that the product has been opened. Then there are the some of the heat induction liner systems, the liner that are attached or onto that of the opening of the bottle, and then the cap is going to be fixed over onto that one. So these are the different types of the special kinds of closures which will fall under the category of, say, the tamper evident closure system, and that is very common in case of the pharmaceutical. Some another kind of closure system that is said to be the child resistant closure system. That means the child should not able to open such kinds of systems. Only the adults they can able to open it, and that too with the help of the two hands, not by the single hand. One hand that is just for holding or pulling something or pushing at the below and then going on rotating by the another hand. So the child resistant closures, these are difficult for drug packaging to be opened by the young childs or the young children's. These are allowing access to the adults only. And this is to minimize the accidents involving the drug intoxication of the children's. These most common reclosable child resistant types of closures are the press and turn. Like say we have to press it first of all, then we have to rotate it. These are said to be the press and turn. Then squeeze and turn. We need to squeeze it and then we have to turn it. And sometimes there is a combination of these two, either press turn and squeeze turn, or there might be press plus squeeze plus turn. So here you can see the particular kind of packaging. There it is needed to just rotate it by pressing it from the top. So from top we need to press it and then we have to rotate it in the anti-clockwise direction. Here you can see that this particular strip that is needed to be removed, or it has to be pressed from the sides, from both the sides, and then it has to be rotated, or just by pressing from both the sides there is a need to lift it up. So again, that is the child resistant kind. In this particular, you can see that this is the particular notch. This notch has to be pressed down. Now once we will going to press this notch, then we have to rotate this particular cap so that it will going to be opened. And in the fourth one, you can see that these are not matching with each other. First of all, we need to match with this, like there is a matching of the numberings, and then we have to rotate it. And such a kind of closure system are very difficult to be operated by the children's. because generally the psychology of the children is seen in such a way that these they can, or these are, they are difficult to handle all these things. So that's why these are very easily handled by the adults. So the child resistant closures that will makes it difficult for the young children to gain access to the contents, but which is not too difficult for the adults to use properly in accordance with the requirements of these standards and the standards that has been given by the European standard. So the European Committee for the Standardization that will works onto the child resistant closure system. So which says that the opening that require the two hands to open the closure, like say this is the push and turn, this is the squeeze to the sides and turn, which is to be pressed, then push down and turn, then line up the arrow. We need to line up all these two arrow need to be matched, and then it has to be opened. Now there is a quality assurance aspect of the packaging. So that is also important in order to ensure the quality of the packaging system. So there are some of the general considerations related with the packaging, the requirements of the national authorities and the relative legislation. The product, the production processes, the manufacturers, internal policies like say the safety, marketing, etc. The packaging processes and the equipment, they need the process of validation and proper qualification. Packaging waste, there are packaging waste, a very small percentage of the packaging waste need to be generated, but its disposal can cause the problems for the environment. Let's say for example, if there is a packaging system like say the glass, plastic, metals and the papers, as far as the papers are concerned, the they will not create too much problem as far as their disposal is concerned, but the issue is associated with the plastics. Great, very high, because say most of the plastic that cannot be recycled, glass that can be recycled, metal that can be recycled, right? So such kinds of hazards, they should not be associated with the that, with the product. Protection to the environment, again that is most important, because say if the product that is contaminated, or if the container or if the packaging material that is contaminated by the product, let's say for example blood and blood related product, or say the product that is the chemicals that are very dangerous to that of the environment, then in that case the process that will becomes, or the process of disposal, that will become very very difficult. Like say we'll be having the general waste material, say from that of the kitchen waste, paper tissues, water bottles and the cans. They can be properly disposed of, they can be subjected to that of the incineration, and then they can be securely filled into that of the land, that is said to be the land filling. If there are infected plastics like say the syringes, gloves, plastic waste, then the autoclaving, that is the pre-treatment is required, autoclaving that will subject to cleaning, and then or making them environment friendly, so that they, after that they will going to be subjected to that of the land filling, that is digging the land and filling into that one. Then infected waste like say the soiled anatomical waste, or say chemical liquids, cytotoxic materials, laboratory waste, expired or the discarded medicines. Again, such types of materials, they need to be first of all autoclaving and say subjected to that of the pyrolysis or say the incineration. Then they will be deeply buried into that of the land. Then the glass materials like say the antibiotic walls or the metallic implants, glasswares materials, and the except some of the cytotoxic, they subject to that of the autoclaving. Then they will be subjected to the process of the recycling. Some of the sharp objects like say the needles, cuts, and the glasses, syringes, or the scalpels, these are very difficult, and they need to be first of all subjected to the process of autoclaving. Then They will going to be uh, pitted, sharply pitted, or say this properly digged and the properly packed or the land filling. So this is the way by which we can go for properly treating all these materials, and some such kinds of the common treatment facility need to be required before going for disposing all these kinds of the packaging materials from the environment point of view. So with this today, we will going to stop here only. We will going to continue in the next lecture. Thank you very much. Have a good day to you all.